What if the reason your blood pressure isn't coming down has nothing to do with what you're eating, Perez, and everything to do with what you're drinking? I've been a geriatric pharmacist for over 2 decades, and one of the most consistent patterns I see in my practice is this. They've cut the salt, they've changed their meals, they're taking their medication every single day, fells, and their numbers still aren't where they need to be. When I dig a little deeper, I almost always find the same thing. Nobody ever talked to them about what they were putting in a glass. Not once. Not in a 10-minute office visit, not in the discharge paperwork, not anywhere. It matters. Because some of what people over 60 drink every single day is quietly working against their blood pressure in ways that are measurable, found.
And some of what they're avoiding or simply not thinking about could actually be doing real work on their arterial walls right now.
So I want to walk you through 7 drinks, not a shopping list, a framework, because each one of these works through a specific biological mechanism. And once you understand the mechanism, you'll know exactly when and how to use it. I'm going to tell you about one drink that's widely considered healthy, something most people in my practice are drinking without a second thought. Research consistently suggests it may be doing exactly the opposite of what they believe. Stay with me through this one, because that last part is the part most people miss entirely. To get into the first drink, let me give you a quick foundation fragment, because this is the part that changes how you think about everything else. Pressure isn't just a number on a cuff. It's a measure of the force your heart has to generate to push blood through your arterial system. And after 60, 2 things are working against you at the same time. Your arteries naturally become stiffer. The elastin in the vessel walls breaks down over time, and the vessels lose some of their ability to expand and contract with each heartbeat. That stiffness alone pushes the numbers up. Many of the medications commonly prescribed to seniors interact with the very nutritional compounds that help keep those vessels relaxed and flexible, which means some people are fighting the problem with one hand while quietly making it worse with the other. What I'll show you today is a set of drinks that work through 3 specific pathways: vasodilation, which means relaxing and widening the vessel's nitric oxide production, which is the molecule your endothelium uses to signal the smooth muscle in your arterial walls to let go; electrolyte balance, specifically potassium and magnesium, which directly regulate how hard your blood vessels contract. Once you understand those 3 pathways, everything I'm about to tell you will make sense immediately. Start here because this is the one I'm asked about most often, and also the one that's most consistently dismissed because it sounds too simple. Sabdarifa, the dried calyces of the hibiscus flower steeped in hot water. It produces a deep cranberry red liquid with a tart, slightly astringent taste. It has one of the most well-documented antihypertensive profiles of any non-pharmaceutical intervention in the geriatric pharmacology literature. Inside your body. Hibiscus is rich in anthocyanins. Those are the same class of polyphenols responsible for the color of blueberries and red cabbage. What makes them relevant to blood pressure is their effect on an enzyme called ACE, angiotensin-converting enzyme. That sounds familiar. It's because ACE inhibitors are one of the most commonly prescribed classes of blood pressure medications in the world. What hibiscus does is inhibit the same enzyme naturally through a different mechanism, which reduces the production of a tensin II. A meta-analysis published in the Journal of Hypertension reviewed 5 randomized controlled trials and found that regular hibiscus tea consumption with the most significant effect in people whose baseline numbers were already elevated. What I tell my patients is this: 2 cups a day, brewed strong, cooled if you prefer it cold. Steeping time, adding sugar, which will work against you. And if you're already taking an ACE inhibitor, talk to your pharmacist before adding this consistently, because the effects can be additive. This is a drink that quietly earns its place in your daily routine. Most seniors I work with have never heard of it. Now you have. I want you to pay close attention to, because the mechanism here is different from everything else on this list, Paul, and the timeline is faster than most people expect. This is one of the richest dietary sources of inorganic nitrate. When you drink it, that nitrate is absorbed in your upper gastrointestinal tract, circulated to your salivary glands by oral bacteria into nitrite, swallowed again, and then in the slightly acidic environment of your stomach and bloodstream, converted into nitric oxide. Nitric oxide is the primary signaling molecule your endothelium uses to tell the smooth muscle wrapped around your arterial walls to relax. When those muscles relax, the vessels dilate, resistance drops, and your blood pressure comes down. Published in the journal Hypertension found that a single 250 ml serving of beetroot juice produced a measurable reduction in systolic blood pressure within 2 to 3 hours pound, and that the effect lasted for up to 24 hours with consistent daily use. Now here's something I want to be precise about for seniors specifically. The nitrate to nitric oxide conversion that happens in your mouth depends on which means that using antibacterial mouthwash daily, something many of my older patients do, can significantly disrupt this pathway. Antibacterial mouthwash twice a day and wondering why your blood pressure isn't responding the way you expect, that's worth a conversation with your pharmacist or dentist. One small glass to 200 to 250 milliliters most days is a sensible starting point. The taste is earthy and distinctive. Don't panic when you notice a change in urine color. It's harmless and expected. I'll walk you through an illustrative scenario. Let's call her Eleanor, 71, retired librarian. She came in about 8 months ago. Systolic was running in the 148 to 152 range consistently. She was already on a calcium channel blocker. Her diet was reasonable. She walked most mornings, drinking a glass of what she called healthy juice with her breakfast every day for 2 years. It was a commercial pomegranate blend, looked premium, said antioxidant on the label. The label also showed 28 grams of sugar per serving. She had no idea. I'm going to come back to that point to tense because it's the reversal in this video that I don't want you to miss. But first, let me tell you what real pomegranate juice, unsweetened and pure, actually does. It is one of the most polyphenol-dense fruits studied in cardiovascular research. The compounds, primarily punicalagins and punicic acid pu, to reduce oxidative stress in the endothelium, improve nitric oxide bioavailability, and inhibit the same ACE pathway we discussed with hibiscus. A 3-year randomized controlled trial published in Clinical Nutrition found that patients who drank 150 milliliter juice daily marker of arterial stiffness compared to the control group. That's not a minor finding. That's evidence of structural change in arterial tissue from a dietary intervention alone. The distinction is pure, unsweetened pomegranate juice, which is tart enough that most people add sugar, which is exactly what you cannot do if you want the cardiovascular benefit. Small amounts, consistently, without added sweetener. That's the protocol. Careful here, because the evidence on green tea and blood pressure is solid but nuanced pest. And the nuance matters for seniors more than for any other group. Green tea contains a class of antioxidants called catechins, most notably EGCG, epigallocatechin gallate, and have been associated with lower systolic blood pressure in consistent observational and interventional research. Analysis published in the British Journal of Nutrition pooled data from 25 studies and found that regular green tea consumption, 3 to 4 cups per day, associated with a statistically significant reduction in both systolic and diastolic blood pressure, with the effect more pronounced in people over 55. Here's the nuance. Green tea contains caffeine. Not as much as coffee, typically 25 to 40 milligrams per cup. Caffeine has an acute vasoconstrictive effect, meaning it temporarily tightens blood vessels in the hours after you drink it. For most people, the net effect of green tea on blood pressure is positive because the catechins outweigh the caffeine effect over time. Particularly sensitive to caffeine, or if your blood pressure tends to run high in the mornings, I'd suggest keeping your green tea to early afternoon rather than morning caffeine. Never after 3 p.m., because the caffeine will also affect your sleep quality, and poor sleep is one of the most consistent drivers of elevated morning blood pressure that I see in practice. 3 cups a day, brewed at around 80 degrees rather than boiling, which preserves more of the catechin content, is the approach I'd suggest. This sounds almost too simple to be worth discussing. I'm going to explain why it isn't. The mechanism here isn't the lemon. Lemon adds a small amount of vitamin C and flavonoids that support endothelial health, but the primary people don't fully understand about how blood pressure is regulated in the kidney. Your kidney is constantly making a decision, how much sodium to hold on to and how much to excrete. Potassium directly influences that decision. When potassium levels are adequate, the kidney excretes more sodium boron, and sodium is the recommended potassium intake for adults is around 4,700 milligrams per day. Research consistently shows that most adults, because the foods richest in potassium, like fresh fruits, vegetables, and legumes, have been gradually displaced by more processed options. A simple morning drink, warm water, the juice of half a lemon, and a small amount of a potassium-rich addition, like a few, but it's a daily habit that nudges your kidney in the right direction, consistently, over time. Note for seniors, if you have kidney disease, or if you're taking a potassium-sparing diuretic or an ACE inhibitor, excess potassium can be dangerous. This is not a drink to add casually if either of those apply to you. Please check with your pharmacist first. It surprises people most in my practice. Not a supplement, not a tea. Plain water ham, but the specific mineral content of that water. It is a cofactor for over 300 enzymatic reactions in the human body. One of its most critical roles is in the regulation of vascular smooth muscle tone. Magnesium acts as a natural calcium channel blocker. It competes with calcium for the same binding sites in smooth muscle cells. That's the same mechanism, incidentally, as an entire class of prescription blood pressure medications. A Cochrane systematic review examining the relationship between magnesium and blood pressure found that supplementation with magnesium produced a measurable, and that the effect was most pronounced in people who were already deficient, which includes a significant proportion of adults over 60. Natural mineral waters, particularly those from European sources that are high in bicarbonate and magnesium, contain 100 milligrams or more of magnesium per liter. That's a meaningful contribution to your daily intake when you're drinking adequate water anyway. Mineral waters that list magnesium content on the label. It's not always prominent, but it's there. Aim for water with at least 50 milligrams per liter. Drink it consistently, not in one sitting. And if you're already taking a magnesium supplement, factor that into the total. Let me come back to Eleanor. When I looked at her food and drink diary, the pattern was clear. Commercial pomegranate antioxidant blend every morning. A glass of what her daughter had recommended as a heart-healthy berry drink in the afternoon. Occasionally, a small glass of what she thought was pure orange juice with dinner. None of these were what they appeared to be. Granite blend, 28 grams of sugar per serving. The berry drink, 32 grams. The orange juice, 26 grams, and almost no fiber to slow the absorption. In a format that produces rapid blood glucose spikes. Mechanism that most people never heard about. When blood sugar spikes rapidly, as it does with liquid sugar and fruit juice, your body releases insulin to bring it down. Insulin activates the sympathetic nervous system. Sympathetic activation causes vasoconstriction and increases heart rate. Repeated multiple times a day, every day, for 2 years. This is not a minor thing. The research has linked chronic patterns of high sugar intake to endothelial dysfunction, reduced nitric oxide same pathways the other drinks on this list are working to improve. Eleanor wasn't fighting her blood pressure, she was unknowingly feeding it. Of the commercial juices, we replaced them with 2 cups of hibiscus tea, a small daily glass of pure beetroot juice, and plain water with mineral content. 2 weeks, working with her physician who was monitoring her numbers throughout, her systolic had dropped from the high 140s into the low 130s teen, without changing her medication.
She didn't need more. She needed different.
5 practical steps, not all at once, 1 at a time. Look at what you're currently drinking that comes in a bottle or a carton and carries an antioxidant or heart-healthy claim on the label. Flip it over, find the sugar content per serving. Above 10 grams per serving, it is likely working against your blood pressure regardless of what else it contains. Add 1 cup of hibiscus tea to your daily routine. Brewed strong, no sugar. This week, not next week. If you're not using antibacterial mouthwash daily, consider trying 150 to 200 milliliters of pure beetroot juice 3 to 4 times a week with your evening meal. Check the mineral content of the water you drink. If it's distilled or very low in minerals, consider switching to a mineral water with at least 50 milligrams of magnesium per liter. Bring this list to your next appointment, not to your doctor, to your pharmacist. Because the interactions between these drinks and your current medications, ACE inhibitors, diuretics, and calcium channel blockers peeing, are worth a specific conversation with someone who knows your full medication list. You now know something that most people your age were never told. Not because the information was hidden, but because a 12-minute office visit belongs to you now. And the next time you reach for a drink, you'll know exactly what it's doing inside your arteries, pal, and whether it's working with you or against you. If you found this useful, share it with someone in your life who's been told their numbers are creeping up. Exactly the kind of conversation they're not having with their care team home. And it might be the most practical 15 minutes they spend this week. I'll see you in the next one.